Well, let me tell you, we have finally sort of cracked the nut of Alzheimer's disease. We've got a long way to go still, but in 20 years we've not had a major breakthrough. And of all the breakthroughs we've had, this is the most important. We actually have 2 drugs now that have been fully shown to be effective. They will officially get their FDA stamps over time. The first one, Leqembi, will be formally approved July 8th. The second one, which does not have a brand name yet, is called donanemab. That'll probably take a number more months because they're not as far along in the pipeline. But both drugs have now been shown to slow the disease process when Alzheimer's disease is caught early. And not just slow it, not just cover it up, but actually change the pathophysiology of the disease. So the cornerstone of Alzheimer's disease from a standpoint of the biology is having a protein that we don't want in our brains called beta amyloid. And both of these drugs take beta amyloid out of the brain. They clean it from the brain. And we've been able to do that for a while, but we've never been able to show that doing that actually slows down the disease, and now we have full proof that it does. So if we take the fact that a lot of these folks are 85 years old, and this drug is for people who are on the pathway towards disease but don't yet have it, and people with very early disease where they're mostly independent, that we're theoretically adding another 5 to 6 years of independence to their life, independence at their home. For that 85-year-old that gets them to 91, frankly, that's a cure, right? So that's a very exciting thing, and clearly about half the patients are 85 and above. Now let's take the sadder case, the person who's 55 or 60 or 65 that develops this disease. So if I'm gonna add an extra 5 or 6 years, that's really, really important. But it's not the same kind of level of effort that we do it when it's 85. We are working around the clock, I tell you, 7 days a week, 24 hours a day, around the world, trying to find drugs for everybody. So young and old will get this drug, but we're gonna need more than this for the younger people in order to maintain their independence at home. I wake up every morning with a giant smile across my face and a kick in my step because we are starting to crush Alzheimer's disease.